So it has been always our duty as Muslims to do the fasting during Ramadan season. Now, the scientific world have always viewed fasting as a form of calorie restriction and somewhat dangerous and done only for religious reasons. Nowadays, actually, the scientific view has changed a lot, and they have started to review the benefits of fasting during Ramadan. So here we're showing the benefits of fasting during Ramadan, or fasting in general, of course. Now, number one, it boosts the cognitive performance. This is especially important for students, as some of them may complain that Ramadan here and we're fasting, but actually it boosts cognitive performance during fasting. Number two, it protects against obesity and obesity-related diseases, like heart diseases, kidney diseases, and hypertension. It can reduce inflammation, which is associated with joint disease, and inflammation associated with artery disease also. Now, it overall improves the fitness of the patient, as the weight reduces during Ramadan, and because the patient feels lighter, or people in general feels lighter during Ramadan, it increases their exercise performance. It also supports the weight loss during Ramadan, and it decreases the risk of metabolic diseases like elevated blood sugar, elevated cholesterol, elevated uric acid. The last thing, which is very interesting, its benefit for cancer patients. Originally, during chemotherapy, patients were advised to take high nutrient diet and high caloric diet because it was thought that it helps boost their immunity. Nowadays, new research have found out that fasting during chemotherapy actually boosts the effects of chemotherapy by first exposing cancerous cells to boosting the immunity, which helps improve the patient and improve the overall results. And finally, the production of a certain kind of cells, the phagocytes, which engulfs the cancer cells and help in the improvement of the cancer output. Diet during Ramadan is very simple, actually. We all follow it, I'm sure, but we all take our breakfast in the same time. Ideally, we should start our diet, our breakfast, with water, which should be actually room temperature, not cold water, and dates. The amount of dates is not clear for most patients. They will say anywhere between 3 and 21, but actually it's 1 to 3 dates, depending on the size of the date. The amount of water also should not be very big. 250 ml is more than enough to break your fast. A small break for prayer, and then we go back to the second course, which is mainly made by soups or vegetables. Either one should be light enough on the stomach to start the digestion process. The second thing would be a main dish. A main dish ideally forms by protein and carbohydrates. Lean proteins like chicken breasts or fish are preferred to red meat, and the carbohydrates are whole wheat bread, brown rice. These are slow to digest and will elevate blood sugar just enough so that it maintains the people throughout the day. Now, after the main meal, usually we take a small snack. These things should be separated, actually not one after the other, total time of between iftar and dawn, between suhoor. A small snack made either by yogurt, milk, or a portion of fruit is taken before time, which is more than enough for most people. And suhoor time is ideally taken just before adhan. Suhoor again has to be made of 2 portions, 1 protein and 1 carbohydrate. Carbohydrates should be always chosen slow digested carbohydrates like complex carbohydrates, including potatoes, and things like whole wheat bread, brown rice, whole wheat pasta in small portions. Other things that we should pay attention to during Ramadan, do's and don'ts. One is leading to Ramadan, we should reduce our caffeine intake so that when Ramadan comes, the first days of Ramadan will not be hard for people who are drinking coffee every single day. And during the month of Ramadan, reduce the amount of caffeine taken, also because it's a non-diuretic and it may reduce the amount of hydration inside the body. Now, second thing is related to number one, which is to stay hydrated. Throughout the day, taking small amounts of water between iftar and suhoor, and it should be room temperature water, because cold temperature water always causes spasms in the stomach. Avoid eating a lot of sweets, because sweets are known to elevate blood sugar to high levels, and then it drops immediately afterwards. So taking a lot of sweets actually results in hunger the next day during fasting. Avoid salty food, especially near the adhan, near suhoor, because it causes thirst in the next day, causes dehydration. Eat also small portions from iftar to suhoor. Avoid eating heavy meals and going to bed, because most of our meals are fixed timing between iftar and suhoor. Now, for diabetic patients, it's a different story. Not all diabetics actually can fast and maintain their blood sugar throughout Ramadan. And the process of preparing a patient for fasting during Ramadan starts 6 to 8 weeks before the month by maintaining their blood sugar levels, checking their kidney function, checking their hydration levels, and adjusting their therapy. Few things that has to be done between the patient and the doctor in order to maintain the blood sugar throughout Ramadan so that the patient can fast. There are few risks associated with fasting during Ramadan for diabetic patients. Number one is hyperglycemia, and it is often associated with increased amount of food at iftar. Hypoglycemia, on the other hand, by reduce the amount of food, but continuously taking the medication that reduces blood sugar. Dehydration is a common complication during diabetics. Another two complications which result from the first three are the cardiovascular disease and kidney function disease. For diabetics, do's and don'ts are actually very much the same as the normal patients, but there are few changes. Like we said before, 6 to 8 weeks before Ramadan, start the preparation with your doctor. Visit your doctor, check your blood levels, check your kidney function, and help maintain your blood sugar by strict dieting before Ramadan. Try to take your food in small amounts throughout the day in order to maintain your blood sugar, and continuously check every 15 days until the day of fasting. Follow with your doctor's instructions. Sometimes a patient has to adjust their doses during Ramadan, either increase or decrease their dosing, and adjust the type of food that they eat during Ramadan in order to maintain their blood sugar while fasting. Of course, for all diabetics, it's the same, and also for normal people. Avoid sweets, a lot of sweets during fasting. Avoid large meals. Divide your meals into small meals throughout the day, and avoid deep fried foods. Now, drink plenty of water, of course, between iftar and suhoor, because dehydration is one of the common complications during Ramadan for diabetic patients. And increase the physical activity to avoid increase in the blood sugar levels during Ramadan. Now, this is very particular thing for diabetics, is to learn how to recognize hyperglycemia, the elevation in blood sugar levels, and hypoglycemia, the reduction in blood sugar. Both things are quite risky for patients, but hypoglycemia is more important because patient can lose consciousness, so has to be treated immediately. We always recommend for patients to have the glucometer device at home, so that if they suspect hyperglycemia or hypoglycemia, they would check their blood sugar and act accordingly. Now, the diet for patients during Ramadan. The diet of a diabetic patient is not different from a diet of a normal patient as long as the patient is maintaining their doses of treatment. There are a few changes that we recommend is that taking the main meal immediately after iftar containing starch and a portion of protein to maintain blood sugar throughout the day, and then start with the soups and other things. Dates are not prohibited completely during fasting and for diabetic patients, but again, the portion should be very limited, 1 to 3 dates, as long as the blood sugar is within control. Stay hydrated throughout the day, drink plenty of water. Follow up with your doctor every 15 days. Diabetic patients usually follow every 1 month, but during Ramadan, every 15 days to make sure that blood sugar is within normal limits. Avoid drinking sweetened drinks, avoid drinking plenty of coffee, maintain physical activity, and also take small portions throughout the day between iftar and suhoor. During suhoor, again, the patient with diabetes should take a portion of starch, especially complex starch, whole wheat bread, brown rice, in order to maintain their blood sugar during iftar time, during fasting, and follow their doctor's instructions in order to maintain their blood sugar throughout the month. A small snack before bed, again, either a milk or fruit, will maintain blood sugar until suhoor time. And most of the complications in patients with diabetes during fasting season often are the same complications that happen to the patient prior to Ramadan. So a patient with hyperglycemia frequently throughout the year will often have hyperglycemic complications throughout Ramadan, and the opposite is also true. Patients who always have dropped blood sugar, hypoglycemia, throughout the year, then this predicts also that hypoglycemia is common during Ramadan time. So stay healthy, stay hydrated. Thank you for listening.